Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
Breast cancer is a type of cancer that forms in the cells of the breast tissue. It is the most common cancer among women worldwide, although it can also occur in men, albeit rarely. Breast cancer can originate from various parts of the breast, including the ducts that carry milk to the nipple, ductal carcinoma, the glands that produce milk, lobular carcinoma, or other cells within the breast tissue. Causes and risk factors. Genetics and family history. A family history of breast cancer, especially if it involves close relatives such as a mother, sister, or daughter, increases the risk of developing the disease. Inherited genetic mutations such as BRCA1 and BRCA2 genes significantly elevate the risk. Hormonal factors. Estrogen exposure over a prolonged period, which can occur due to early menstruation, late menopause, hormone replacement therapy, or not having children or having them later in life, can increase the risk. Age. The risk of breast cancer increases with age, with the majority of cases occurring in women over 50 years old. Personal history of breast cancer or certain non-cancerous breast diseases. Women who have previously had breast cancer or certain benign breast conditions such as atypical hyperplasia or lobular carcinoma in situ are at higher risk. Lifestyle factors. Factors such as excessive alcohol consumption, obesity, lack of physical activity, and a high-fat diet have been linked to an increased risk of breast cancer. Radiation exposure, previous radiation therapy to the chest area, such as for the treatment of Hodgkin's lymphoma, increases the risk of breast cancer later in life. Types of breast cancer. Ductal carcinoma in situ, DCIS. This is a non-invasive breast cancer where abnormal cells are confined to the milk ducts and have not invaded nearby tissue. Invasive ductal carcinoma, IDC. This is the most common type of breast cancer where cancer cells have invaded surrounding breast tissue outside the ducts. Lobular carcinoma in situ, LCIS. Abnormal cells are found in the lobules of the breast, but have not invaded surrounding tissue. LCIS is considered a risk factor for developing invasive breast cancer. Invasive lobular carcinoma, ILC. Cancer cells originate in the lobules of the breast and have spread to nearby tissues. Symptoms. 1. Lump or mass. Description. The presence of a lump or mass in the breast or underarm area is the most common symptom of breast cancer. These lumps or masses may feel firm, irregular in shape, and different from the surrounding breast tissue. They are often painless but can sometimes cause discomfort or tenderness. Significance. While not all breast lumps are cancerous, any new or unusual lump should be evaluated by a healthcare professional. Prompt evaluation is crucial for early detection and diagnosis of breast cancer. Many breast lumps are benign, non-cancerous, such as cysts or fibroadenomas, but it's essential to rule out malignancy through proper examination and testing. 2. Changes in breast size or shape. Description. Breast cancer may cause changes in the size or shape of the breast. This can manifest as swelling, enlargement, or asymmetry between the breasts. The affected breast may appear visibly different from its normal size or shape. Significance. Significant changes in breast size or shape, particularly when accompanied by other symptoms or risk factors, warrant further investigation. While hormonal fluctuations, pregnancy, or weight changes can also cause temporary changes in breast size, persistent asymmetry or distortion should be evaluated by a healthcare professional. 3. Skin changes. Description. Breast cancer can cause various skin changes on the surface of the breast. These changes may include dimpling or puckering of the skin, similar to the texture of an orange peel. Redness, inflammation, or warmth in the breast area may also be observed. In some cases, the skin may appear thickened or have an orange peel texture known as peau d'orange. Significance. Skin changes associated with breast cancer are often indicative of underlying malignancy. These changes occur due to infiltration of cancer cells into the surrounding tissue, causing distortion of the skin's normal structure. Any new or unusual skin changes should be promptly evaluated by a healthcare provider to rule out breast cancer or other serious conditions. 4. Nipple changes. Description. Breast cancer can cause changes in the appearance or behavior of the nipples. This may include inversion or retraction of the nipple, where the nipple appears to be pulled inward instead of protruding outward. Discharge from the nipple other than breast milk may also occur and may be bloody, clear, or colored. Additionally, scaling, crusting, or ulceration of the skin around the nipple may be observed. Significance: changes in the nipples are concerning symptoms that should be evaluated by a healthcare professional. While some nipple changes may be benign, such as eczema or nipple dermatitis, they can also indicate underlying breast cancer. Any persistent or unexplained nipple changes should be investigated to determine the underlying cause and appropriate management. 5. Breast pain. Description: breast pain or tenderness is not typically a common symptom of breast cancer. However, some women with breast cancer may experience localized pain or discomfort in the breast or nipple area. This pain may be intermittent or persistent and can vary in intensity. Significance: breast pain alone is rarely indicative of breast cancer, especially if it is cyclical and associated with hormonal changes during the menstrual cycle. However, persistent or unexplained breast pain should be evaluated by a healthcare professional to rule out underlying breast conditions, including cancer. Diagnosis: clinical breast examination, CBE. A healthcare provider examines the breasts and underarm area for lumps or other abnormalities. Mammogram, X-ray images of the breast are taken to detect any suspicious areas or masses. Ultrasound. Sound waves are used to produce images of the breast, particularly to further evaluate abnormalities detected on a mammogram. Biopsy. A sample of breast tissue is collected and examined under a microscope to determine if cancer cells are present and to determine the type and characteristics of the cancer. Treatment. Surgery. Options may include lumpectomy, removal of the tumor and surrounding tissue, or mastectomy, removal of the entire breast. Lymph node removal may also be performed to assess whether cancer has spread to nearby lymph nodes. Radiation therapy. High-energy rays are used to target and destroy cancer cells in the breast or surrounding tissues. Chemotherapy. Anti-cancer drugs are administered intravenously or orally to kill cancer cells or prevent their growth and spread. Hormone therapy. Medications that block the effects of estrogen or lower estrogen levels in the body may be prescribed for hormone receptor-positive breast cancers. Targeted therapy. Drugs that target specific molecules involved in cancer growth, such as HR2-positive breast cancer, may be used. Immunotherapy. This treatment uses the body's immune system to recognize and attack cancer cells. Prognosis and survival rates. The prognosis for breast cancer depends on various factors, including the stage of the cancer, the type and characteristics of the tumor, the individual's age and overall health, and the effectiveness of treatment. Early detection and treatment generally lead to better outcomes. 5-year survival rates for breast cancer vary widely depending on these factors, but have been improving due to advances in detection and treatment methods. Prevention. Regular breast self-exams. Perform monthly breast self-exams to become familiar with the normal look and feel of your breasts, and to detect any changes promptly. Regular clinical breast exams and mammograms. Follow recommended guidelines for regular screening mammograms and clinical breast exams based on age and risk factors. Maintain a healthy lifestyle. Eat a balanced diet, maintain a healthy weight, limit alcohol consumption, and engage in regular physical activity. Know your family history. Be aware of your family's history of breast cancer and discuss any concerns with your healthcare provider. Consider genetic testing. If you have a family history of breast cancer or other risk factors, consider genetic counseling and testing to assess your risk of inherited genetic mutations. Breast cancer is a complex disease with various risk factors, symptoms, and treatment options. Early detection through screening and prompt treatment are crucial for improving outcomes and reducing mortality rates associated with breast cancer. It's essential for individuals to be proactive about their breast health. Maintain regular screenings and seek medical attention promptly if any changes or abnormalities are detected.